Hey doc, I didn't do anything to myself. All I did was bend forward, I twisted, and I picked up a pencil or a paper clip or something insignificant. All I heard was a pop, I dropped, I couldn't get up. It was severe excruciating pain and I had symptoms down my leg. That sounds familiar to some people. And if you happen to stand outside and see that scenario, a lot of people get scared because the person you loved or your friend or just even a random stranger just dropped for no reason whatsoever. Let's talk about it. What happened on the inside? Let's take a look and see what happens with a person that bends forward and drops to the floor. Well, if you have a little bit of damage through these outside fibers and the nucleus inside the disc there, what happens if it's damaged a little bit? Well, once he bends forward, in our case, you can start seeing there's just a little bend forward. You can see it starts adding pressure right here. It's still inside our disc, but it's not coming out, but it's already under stress. If we have even tiny bit of damage in here, it can easily rupture this and start adding pressure. But it doesn't have to be a full-on herniation. It can be just a little bit of a bulge. So let's see if we can do this here. Boom. Doesn't have to be a full-on herniation, all it has to be a little bit of a bulge, and that'll be enough to start aggravating this nerve. A bulge or any inflammation around here within an inch or so can start adding pressure to this nerve, and that once you start adding that pressure, once I start feeling this is where you start feeling shooting pain and the severe pain and discomfort. Right, so next step is, yes, we can do forward. What if we do a twist? Well, same thing, right? I'm gonna actually make this a little bit easier to see on this model. What happens if we twist? And you can see same thing once again. Once we twist this, you can see there's a lot of pressure. What's the worst case scenario? Twist, bend forward, and out, add a lot of pressure, and boom, there it goes. The hernia is right there. So it doesn't have to be lifting a lot. All you have to do is lift just a little bit, and that's going to be enough. Or in a lot of cases, somebody lifts something heavy, especially if it's with a far and outstretched, let's say a bucket of water or something, and that's all it takes. And then the person goes down for the count, and it takes a little bit to come back and to fix this. All right, let's talk about how to fix this. First thing, don't mess it up, don't make it worse. Yep, I know this kind of sounds strange and obvious, but if your day-to-day life you have to move and twist, and this gets worse with moving and twisting, let's protect it. Let's put a lumbar brace on it. And I'm not talking about your lumbar brace from Home Depot or Lowe's. No, I'm talking about medical specific lumbar brace that are designed to stop this from happening in the first place. In fact, a lot of them will be there to take off the pressure of the disc and allow you to heal much faster, quicker, and prevent you from messing up. That actually brings me to the next point. How do we heal this? Well, chiropractic works great. The other one is decompression tables work even better, or flexion distraction tables work amazing too. So how do they work? They create what we call a negative pressure in the disc, which means we're going to take these two vertebrae and we pull it that way, taking off the pressure of the disc itself, which allows the disc to go back into the belly of the beast, or the jelly goes back into the donut, whatever analogy you want to use. That goes back in. So once the jelly goes back into the donut, once the nucleus go back into the disc, your body needs time to heal. This is made out of fibers in your body. It means it takes a long time to heal. We're talking about anywhere between 3 months to 3 years to actually fully heal on the inside. It's not a fast process. It's a very, very slow process to heal up there. Doesn't mean you'll feel the pain. It just means it's going to be healing very slowly. And once that pressure of this nerve is gone, you shouldn't feel the disc, but it also means that even though you don't feel the pain, it's really easy to re-injure. That's when, once again, those lumbar braces come in helpful to be on you for a while to keep you safe and prevent you from re-aggravating or making this worse in the future.